My name is Jolene Neto, and for this video I'm going to be demonstrating the chest tube. For the purposes, this is the bed and this is the patient, and the chest tube system is on the floor. So the first one we're going to do is the Ocean. For this one, you're going to want to verify the patient's name. At this time, you're going to be assessing the patient, and you're going to notice that there's an air leak because there's titling in the water seal chamber, which we don't want. So you're going to want to explain to the patient that there might be a possible air leak, and you're going to want to assess the patient's vitals, pain if any, and then you're going to want to cleanse your hands, and you're going to put on gloves. You're going to want to clamp the tubing from the patient, and you're going to be on the patient's side where the tube is, so that way you can see when the bubbling stops to the titling stops. That way you know exactly where the air leak is. So you don't want to clamp for a long time because it can cause tension pneumothorax, and it can cause difficulties with the patient. So you're gonna want to clamp, and then the titling doesn't stop, so you're gonna keep going down and unclamp, and you're gonna keep going down, and then finally the titling will stop, and so you know that the air leak is in the drainage system and not from the patient. So you're gonna unclamp, you're gonna call the doctor, you're gonna give the doctor an S-bar report. So you're gonna, the IS-bar, so you're gonna call the doctor, you're gonna introduce yourself, let the doctor know that you're the nurse taking care of the patient. The S is for situation, so you're gonna let the doctor know that you went in to assess the patient's chest tube drainage system, you noticed titling, you clamped it, and you found the air leak was in the tubing of the chest tube drainage system and not from the patient's chest tube itself. You're gonna want to give the patient's vitals and the patient's status. You're gonna wanna give the patient's background. So this is a 47-year-old patient, status post-MVA with the chest tube placed in the ER for drainage of fluid, of blood. So it's gonna be the it's gonna be draining blood. So you're gonna want to give the doctor a recommendation and ask the doctor if they're gonna want to change the chest drainage tube system. Sometimes the titling may be because the patient's lungs are already expanding on their own and the chest tube drainage system has done its job. So the doctor can also decide at that time to just remove the chest tube. And that's why it's important to give the situation, the vitals, and the status of what's going on with the patient. So since we found the air leak, we're gonna wanna get another system ready. So the patient is hooked up to a system already, so you're gonna wanna get another system ready. So for this video, we're gonna pretend this is my new system. It's the Ocean. You're gonna want to remove the system from the blue packaging. You're gonna wanna make sure that it's the Ocean because that's what the patient was using before. So you wanna replace it with the same one. You're gonna remove the stopper so you can fill chamber A with 20 centimeters of water. So you're gonna want it to go up to the 20 centimeter line. You're gonna replace the cap. You're gonna want to put the normal saline in this suction control. So you're gonna wanna make sure that the stop clock is sideways, which indicates that it's closed. So that way you can put the right amount of normal saline in there. Once that is done, then you're gonna open the stopcock to allow the water to go in the air leak chamber. You're gonna close it and you're gonna remove the little funnel on there. You're gonna want to make sure that it's at the 2 centimeter line, and you're gonna want to disconnect or undo the tape on the patient. You're gonna want to disconnect the patient from the old tubing system and connect the patient right away to the new tubing system. At that time, you're gonna turn off the suctioning to the other system, and you're gonna connect the suctioning to the new system. You'll have to play with the stopcock to get a continuous bubbling in the water seal chamber to make sure that it's a continuous gentle bubbling. And you can control that with the stopcock. If it's sideways, it's closed. If it's up and down, it's open. You're gonna wanna assess the patient again and make sure that the system is working correctly. If the patient was on a dry tubing system, you're gonna want to, it's gonna be arranged differently. So I'm gonna change this around real quick. So it's just gonna have the stopcock on this side. And it doesn't have this tubing that it has on the ocean because it's a dry water chamber. So you just have the patient. You're gonna have a little tube for the suction, and you're going to want to ask the provider what he wants to suction at, because this system has a dry suction, so it just has a dial, and that one you can do 20 to 40, whatever the doctor's ordering. It has a pre-filled syringe, so you're gonna take the pre-filled syringe, you're gonna pour the water in the water seal chamber, which is chamber C, to the 2 centimeters, and you're gonna wanna connect the patient. Once you connect the patient and you can connect it to suctioning, the bellow, the orange bellow, is gonna come out, which is gonna let you know that the system is working correctly. At that time, you're gonna wanna reassess your patient, and you're gonna wanna let the doctor know how the patient tolerated changing the system and that the system was changed correctly. And you're also gonna wanna document. If for some reason the patient was in transport and somehow, some way, the tubing became disconnected from the patient, you're gonna wanna put a 4x4 gauze over the insertion site. You're only gonna wanna tape it on 3 sides, so that way there's a vent, but it prevents anything from getting in there. And you're also gonna want to call a rapid response team, because they're gonna need to reinsert the tube as soon as possible to prevent anything from happening to the patient. And that's my demonstration on the chest tube system.